Thank you, Nathan, and thank you everyone for having me today and for allowing me to join this panel. I am just going to quickly touch on what I'm going to cover in my portion of the presentation. So I am going to introduce and explain essential terms associated with HIV criminalization, document the scopes and features of criminal laws. I'll touch on, I know Nathan is going to do a deeper dive into explaining the harms caused by criminalization, but especially for people who are Black, Brown, and LGBTQ+. So CHLP, a little bit about our organization. We're a multiracial organization that uses a Black feminist queer lens to analyze the issue of discrimination, criminalization, and oppression of people affected by HIV and other stigmatized health conditions. So HIV criminalization represents a facet of the broader oppression of people living with and deeply affected by HIV, especially Black people, LGBTQ plus folks, working class folks, people who use drugs, and people who engage in sex work. We envision a world free from state violence where people are not dehumanized and punished for their real or perceived health status and our identities, and where health conditions are not met with criminalization, surveillance, and other punitive responses. Next slide, please. All through 2025, we went through a process where we took a step back and asked ourselves the big questions, like what does it mean to build a future where people living with HIV and other stigmatized health conditions can live free from surveillance, punishment, and criminalization? So our new strategic plan begins to answer that question, and it really is a guide for how we're going to be engaging in our work. And I encourage folks to check it out if you really want to look at applying an abolitionist framework that is rooted in liberation. If you scan the QR code, it will actually take you to our strategic plan. Next slide, please. So I am the Senior Positive Justice Project Attorney. PJP is a central component of CHLP's work, and we work with state and local coalitions of people living with HIV, advocates, researchers, nonprofit leaders, government officials, and other stakeholders. Next slide, please. Okay, so I want to start with grounding us with our shared definition of HIV what we mean by HIV specific, when we're talking about criminalization statutes. So a law is HIV specific when it solely names HIV or uses an expansive definition of communicable disease that includes HIV, because it imposes criminal penalties or heightened criminal penalties on the behavior of an individual by explicitly singling them out based on their positive status. So the terms used to single out people living with HIV are going to be really diverse. And the language is going to vary from state to state and jurisdiction to jurisdiction. And it can include anything like communicable disease, contagious disease, infectious disease, sexually transmitted disease. A broad range of language is going to be used there, but all doing the same thing. So regardless of the exact language that's used, the effect is the same. Someone's health status is named and it's used as a means to criminalize them. Next slide, please. So what do we mean when we say HIV criminalization? I wanted to start with outlining that HIV criminalization refers to laws, policies, and practices imposing that heightened criminal penalty on people living with HIV for conduct that is not criminalized or criminalized less severely for people not living with HIV. These increased penalties could manifest as distinct criminal offenses, such as exposure and transmission offenses, enhancements that increase the length of incarceration or fines, forced testing or treatment, or other severe penalties such as registration on the sex offense registry and compliance with those extensive restrictions. HIV criminalization could also occur through general criminal codes, so it doesn't have to be an HIV specific statute. Here we're talking about things like aggravated assault, for instance. They don't specifically mention HIV or another communicable disease. And case law has been interpreted that these general criminal laws as being applicable to behaviors of people living with HIV. So example for aggravated assault, it would be the court classifying someone's HIV status as a deadly weapon. HIV criminalization is a product of inaccurate, stigmatized views based in queer phobia, white supremacy, and misogyny. These laws emerged from and perpetuate these prejudiced, ignorant ideas. And we know that from enforcement data that Williams Institute and Nathan are going to go over, that these laws especially affect people with intersecting marginalized identities, so folks that sit at the intersections, such as transgender and cisgender women, Black women engaging in sex work, LGBTQ plus people who use drugs. Next slide, please. I do want to get a little bit more into some of the nitty gritty. Sometimes folks get confused about this specific language, so I think it is helpful to define them. So among laws that are HIV specific, there are generally two types of laws: offenses and enhancements. So an offense is a law that imposes criminal punishment for engagement in certain behaviors. Um, so this is going to be anything that is criminalized for people living with HIV, but not for folks that aren't living with HIV, such as having consensual sex or donating blood. Whereas an enhancement imposes a heightened punishment on top of an existing punishment. For people living with HIV, these are increased penalties for engaging in criminalized behavior, such as sex work or sharing drug use equipment. So typically, for example, sex work, that is a misdemeanor offense in most states. However, if you're a person living with HIV, it's going to be an automatic enhancement to a felony. Next slide, please. Offenses or enhancements can then be broken down into several different categories. So, exposure, transmission, and non disclosure offenses are often used interchangeably. However, typically these are separate and distinct offenses, and you have to look at the exact statutory language to interpret which activity is being criminalized. Under an exposure law, criminal penalties on people living with HIV for engaging in specific behaviors that purportedly create the possibility of HIV transmission. So, such as having sex or sharing syringes, or more broadly, exposing another to HIV through any means or contact. This does not mean that there's an actual risk of transmission, but instead, the focus of the law is on the perceived risk of transmission. Transmission laws impose increased criminal penalties for the transmission of HIV from one person to another. So, for that, we have to have seroconversion. And a non disclosure law. So, while many states impose criminal penalties for exposure or transmission, some states additionally impose criminal penalties on people living with HIV for non disclosure of HIV status to their sexual, drug use, or other partners. That is these states criminalize distinct behavior. So, for example, in Indiana, they have a duty to inform law where people do not fulfill this duty to inform are punished through Indiana's failure to comply law. Next slide, please. I just wanted to briefly touch on some of the history of HIV criminalization. Excuse me, I'm so tongue-tied today. Legislation criminalizing the transmission or alleged exposure of HIV started in the 1980s in response to specific events and was largely fueled by homophobia and panic that the developing AIDS epidemic, perceived at that time as an exclusively gay male disease, would spread to heterosexual majority populations and communities. By the late 1980s, the federal government got involved, promoting HIV-specific criminal laws in response to rising rates reported among gay men. And President Reagan's 1987 Presidential Commission on the HIV epidemic recommended that states adopt HIV-specific criminal laws because they believed the existing penalties under assault laws were too lenient to deter intentional exposure. So several years later, the Ryan White Comprehensive AIDS Resource Emergency Act, or the CARE Act, was enacted, and it actually conditioned additional funding to states based on the fact that they had criminal laws that would address intentional HIV exposure and transmission. And so that's really where we see the proliferation of these laws. Next slide, please. I want to talk about some of the common features. So most HIV criminal laws, transmission is not required. Any activity viewed as sex and allegations of non-disclosure are enough. A risk of transmission is largely irrelevant. So it doesn't matter if you took risk reduction measures. It's not a defense to prosecution. Condom use, low viral load due to treatment, it doesn't matter. Whether you engaged in negligible or zero risk activities such as oral sex or spitting, they're still criminalized. It does not matter. In fact, just 2 years ago, someone in Ohio was imprisoned for a year for having oral sex without allegedly disclosing their status, even though we know that that is a negligible risk of transmission. So you're not going to transmit HIV that way. Intent to harm is rarely considered or required. So a person does not have to have the specific intent to expose or transmit HIV. And proof of disclosure is often the only defense. So one person's word against another's, which is exceedingly difficult to prove in a court of law. And these laws often impose severe and disproportionate punishment. So felony level punishment and sex offense registration occurring in 5 states. Next slide. I was just going to go over our maps. You can find them online. There is a QR code. It talks about the 32 states with an HIV-specific exposure or transmission offense, and breaking down our HIV specificity scale as well. I won't spend too much time on it, but just giving you an overview and a snapshot. Next slide, please, is just going to be the QR code. If you want to scan it now, feel free. If not, we can share the slides and you can visit our website afterwards as well. Next slide, Nathan, please. Thank you. And to be clear, there's no evidence that these laws improve public health. That is, there's no evidence that they deter behaviors more likely to result in transmission, promote disclosure, or reduce the number of new diagnoses. But there's broad and growing evidence that these laws actually harm our communities. They exacerbate stigma against HIV and people living with HIV. And stigma remains a huge problem, threatening the health and safety and well-being of people with HIV. They worsen barriers to HIV prevention, testing, and treatment services. They perpetuate a one-sided message about sexual health and prevention responsibility. It should not be the sole responsibility of the person living with HIV to engage in these conversations, but a shared responsibility between adults. These laws also disproportionately harm marginalized populations, including people of color, LGBTQ+ communities, sex workers, people who use drugs, and undocumented immigrants. And lastly, the laws undermine care and support for people living with disabilities, including people living with HIV, by reinforcing ableist systems that criminalize health conditions. Next slide. I just wanted to point out that we have been making some movement, recognizing these harmful consequences. Leading public health organizations and medical societies have denounced HIV criminalizations. And many of these groups also joined CHLP in developing a consensus statement opposing HIV criminalization. Next slide, please. I just want to point out that recent trends within its attacks on Black, Brown, and LGBTQ and immigrant communities, as well as women and femme folks, the federal administration has moved to defund, stigmatize, and criminalize health research and care. That makes it less likely that people will be able to access treatment and prevention services, and more likely that they'll be criminalized under state criminal laws targeting people with stigmatized health conditions. We have made some wins and some strides in the past couple of years. So North Dakota and Maryland became the 4th and 5th states, respectively, to repeal their HIV-specific offenses. But we continue to fight and we continue to bring our intersectional lens, because there are states such as Louisiana where there are efforts to expand criminalization, and it remains a threat across the United States. House Bill 76 in Louisiana is one of those examples. It would have criminalized anyone living with an STI. So we worked with the Louisiana Coalition on Criminalization in Health to defeat the bill, turning it into a study resolution that will look for meaningful solutions to the STI epidemics, such as expanded access to prevention medication. So I think we are still wary and on the lookout for any sort of legislation that may actually expand criminalization, especially under the Trump administration, and knowing that they are taking more carceral approaches. My last slide, Nathan, if you'll progress the slides, is just a link to our source book. So if you want to learn more about how folks living with HIV can be subject to prosecution in your state, please check out the source book. It outlines punitive laws and policies and cases affecting people living with HIV in all 50 states and U.S. territories. And thank you so much. I will pass the microphone back over.